Hello friends, today in this video we'll discuss about important one-liners. So that too, to be specific, it is like most common causes. Okay, there will be a list of most common causes in microbiology. Let us revise that. So here the first question is the most common mode of MDR is multi-drug resistant using the plasmid. Okay, so always remember the multi-drug resistance, it usually get transduced by plasmid. So that process is usually, it is in conjugation. So if they are asking most common as an overall cause, it is in conjugation. But if they are asking in specific, so like what is the mode of transmission for multi-drug resistance among the Staphylococcus aureus, then it is in transduction. Okay, so then if they are asking for it, Streptococcus pneumoniae, it is in transformation. So these are some of the important points you want to remember in the what is that, genetics. So if they are asking overall, it is in conjugation. If they are asking specific for Staphylococcus aureus, it is in transduction, and if they are asking for pneumonia, it is in transformation. Hope these 3 points are clear for you. And next, coming for complement. Okay, so among the complement, which if they are asking most abundant complement, it is in C3. But if they are asking about complement deficiency, it is in C2. So you want to remember these 2 points. So next, it is in the most common cause of primary immunodeficiency disease. It is an isolated IgA. So you can remember like primary. So first letter, it is in first letter in the alphabet, it is an A, right? So you can remember like IgA deficiency. So friend, this have been asked in some of the exams. Okay. Next. So most common site of human colonization of the Staphylococcus aureus. As you know, it is one of the important pathogen in causing an MRSA, right? So if you remembering this MRSA, the treatment is like they will be treating a nasal caries, and they also using a mupirocin ointment. So the most common site is, it will be present in the anterior, the nostrils. So they can also ask in the form of history also. Okay, so you want to know that it is most commonly present in the nostrils. So second, next question is the most common cause of furuncle skin soft infection, surgical wound infection, pyomycetes, spinal epidural abscess, and then septic arthritis in the native joints. Okay, and acute osteomyelitis. So here the most common cause is Staphylococcus aureus. So if you come across these points like any history of boils or any history of furuncle and then pyomycetes, you can go for Staphylococcus aureus. So next question is, see, most common cause of primary bacteremia, it is in cons. Second most common cause of primary bacteremia, it is in Staphylococcus aureus. So friends, I think you can go through this video or you can make a notes of it. Okay, I'm sure some question will be coming because the most common cause, it is an important for all the MCQs, and they can also ask these in MCQs like what is that, question format, as you know, in case of like clinical scenarios. Okay, so you can note out or you can just go through this video itself. So next point is, see, most common cause of virulence association in Staphylococcus aureus. As you know, Staphylococcus aureus produces an n number of virulence factors like what is it, GNase, lipase, and thermonuclease catalase. But the most important in causing diseases, it is in coagulase. So another point you want to know here is this is an gram-positive cocci producing an coagulase. There is a bacilli which is also producing an coagulase. It is an Yersinia pestis. Okay, you just remember that point also. And Most common method for typing of is Staphylococcus aureus. It is in fast typing. Okay, so this is an important cause of native valve endocarditis is Staphylococcus aureus. Again, another point, it is a native wall osteomyelitis. I told you before. So native wall, that is also caused by Staphylococcus aureus. And most common cause of endocarditis in IV drug abuses. Okay, so if it is in right sided heart is involved, it is in Staphylococcus aureus. If it is on left side, it is an enterococcus. So you can remember like left, right, L, E. So E for enterococcus. Okay, so just it is a mnemonic to remember. So most common cause of prosthetic valve endocarditis, that is an early. So again here early means, so both the prosthetic usually involves in staphylococcus. Okay, but here late it is in streptococcus. So whereas early it is in Staphylococcus epididymis. So you can remember like E for E. Okay. So next it is in late, it is in viridans. That is in Streptococcus viridans. So you can remember like if a person are coming late to the school, the the principal will be acting very virulent or violent, like that you can remember. So early E for E and late it is in viridans. So next, the most common cause of subacute bacterial endocarditis, it is a Streptococcus viridans again. So friends, this will be little confusing, but it is an important points, okay? And so next, it is the most common cause of again pharyngitis, scarlet fever, pyoderma, erysipelas and cellulitis. If you come across Streptococcus pyogenes, you can go through that. Okay, so but you want to be more specific, I'm sure they won't give both the Staphylococcus and Streptococcus pyogenes together. If you come across cellulitis and you have come across option Staphylococcus aureus, you can go for that. Okay, so but they won't give both the options, that I'm sure. Either any one of them they will be giving. So next, the most common cause of toxic shock syndrome, as you know, it is in Staphylococcus aureus. So toxin responsible for toxic shock syndrome, it is in toxic shock syndrome toxin, and it is in superantigen 2. So and then the most common cause of bacteremia in toxic shock syndrome, it is in Streptococcus. So the Staphylococcus aureus, it won't cause bacteremia that much extent as compared to the Streptococcus. So if they are asking toxic shock syndrome associated with bacteremia, then it is in Streptococcus. Thus they are asking as it is most common cause of toxic shock syndrome, then it is in Staphylococcus aureus. So coming for next question, the most common cause of the lobar pneumonia. Yeah, it is a pneumonia, so it is a Streptococcus pneumoniae. And so most common cause of bacterial meningitis in the adult, it is in Streptococcus pneumoniae. And also Neisseria meningitis. And also if they are asking bacterial meningitis in the newborn means, so you want to make out the option like Streptococcus agalactiae and Listeria monocytogenes. So any one option they will be giving. Okay, the question that not be that much confusing so that you can't able to choose the answer. So most common source of infection in human nasopharyngeal carriers. Yeah, it is in meningitis. Okay, so as you know, for Staphylococcus aureus, it is usually present in the anterior nads, whereas meningitis, it is usually meningitis present in the nasopharynx. So coming for gonococcal infection, so the most common manifestation usually present in the male as urethritis, whereas in female it is in cervicitis. Okay, so and this is a next question like the most common cause of pelvic inflammatory disease. So the world, if they are asking for worldwide, you can go for gonorrhea, and if they are asking specifically for India, it is in tuberculosis. Okay, the most common cause of urinary tract infection, it is in E. coli. And again you want to know about here what is a cause concept. It is nothing but there is an, it's a bacterial count, it has to be to the 10 to the power 5. So the most common cause of catheter associated urinary tract infection is E. coli, but most common cause of UTI in the sexually active young women, it is in Staphylococcus saprophyticus. So friends, as far as I know, this term they have been giving specifically. Okay, so UTI in the sexually active young women. So if you come across this term, you can go for saprophyticus. And most common cause of nosocomial UTI, it is in E. coli. Okay, so these are some of the confusing point you want to remember among the UTI. So you just remember the most common cause is E. coli. And then if they are asking for sexually active women, then it is in saprophytion. So most common cause of infection in COPD patient, it is in H. influenzae. Second most common infection is caused by an Moraxella catarrhalis. Okay. So next, friends, this you want to remember like some of the most common forms. Okay. If you're coming across a disease, if you there will be in types. Okay, like if you're coming for anthrax, there is a cutaneous, inhalation, and the intestinal. So among that, which is the most common form like that. So here first, it is in most common cause of diphtheria, it is in respiratory. Most common form of anthrax, it is in cutaneous anthrax. As you know, cutaneous anthrax, it will be having an eschar, that is called as a malignant pustule. See, most common form of the bioterrorism agent, that is, it's a pulmonary anthrax. Okay, so it is used as a bioterrorism weapon. So most common cause of plague, it is in bubonic plague. And important point here you want to remember, it is in Bayesian strain and bipolar appearance. So most common form of histoplasmosis, it is in pulmonary. So here you want to remember this pulmonary histoplasmosis, it is in similar to the tuberculosis. Okay. So most common cause of aspergillosis, it is in pulmonary. Most common cause of mucormycosis, it is in rhinocerebral form. And another point, it is in most common among the diabetic ketoacidosis patient. Okay. See, the most common cause form of sporotrichosis, it is in lymphocutaneous. So most common form of actinomycosis, it is in cervicophageal. And most common form of nocardiasis, it is in pulmonary. And most common form of leprosy, it is in tuberculoid. So most unstable and the uncommon, it is in borderline. So why it is called as an unstable is like if the patient develops good immunity, he can go for tuberculoid type, or if the immunity get worsens, he can develop into a lepromatous. Okay, so this is in deciding factors. So BB, it is in deciding factor. So it is an unstable or the uncommon form. Okay.